Now that we are approaching Christmas and the summer holidays, we have the best tips from a cosmetic doctor on how to plan your treatments to get the best results. Good morning to you, Dr.
Morning,
Francis.
ladies.
How are you today? How can someone plan their cosmetic treatment so they can get the best results and don't miss out or look bad before the holidays?
Well, it depends on what you'd like to achieve, and you need to know how long that treatment takes to work and whether it's got any downtime. So looking forward, the treatment that takes 2 months to work well, but even better 3 months, is the non-surgical fat reduction treatments.
Yeah, tell me all about this one.
Right, now these are either freezing, and they have names like cool this or cool that, or heating, which is what this one is. This one's called True Sculpt. And what you can see is someone who had their back fat and their abdominal fat done, and you can see the strategic combination has given them a very nice result at the 3-month point. So be aware of that as you move towards Christmas, that you have to start early. Now, you've still got time to get 2 really good hair removal sessions done before Christmas, and that could really clean out quite a lot of hair for you and make you feel really good.
Is that sort of IPL or one of those kind of things?
Yes,
yeah.
Some people have lasers and some people have IPL. The ideal candidate for hair removal is someone with the lighter skin and the darker hair, and you want to do it before you get a lot of tan, because then it's harder for you to get a result. So now's the time before you start getting too much sun.
Yeah, and you don't want to go into the sun after you've had it done either, do you?
Well, I think it's all right, but unless you want to have more during summer, you know, then it's harder to do the job for you, or you might be turned away, depending on the person. Now, remember that botulinum toxin can last you 3 to 5 months, depending on the person, and it works within 4 to 14 days.
Is that Botox? Sorry.
Yeah.
Yes.
Yep.
Okay.
Botox, Dysport and Xeomin, the 3 brands. And then dermal fillers do have instant results. However, you might be a little bit swollen for a few days, you might get an occasional bruise, you can't, you know, because we are using needles and things. So I think you need to be aware, this is a hydrating dermal filler for
amazing.
for thin, crepey skin.
Wow.
And this is quite a lot of filler was used, but I wanted to sort of show what I could achieve. I mean, that's what you can achieve. And this is a 3 ml lunchtime lift.
Wow.
That's what you can get for 3 mils. You know, you can take 5 years
when
off.
you say 3 mils
of filler.
Of filler.
Yeah, which is usually hyaluronic acid, which is a clear sugar sort of, I was going to say syrup. It's not sugar syrup, but it's a sugar molecule that's found in all animals.
So it's not a toxin, it's not going to make us unwell,
No, some people, a very small percentage can have lumps, and a very small, you know, you don't want to inject the dangerous areas, which are the between the eyebrows and the nose. I do like to see young women to talk to them about it if they want to have their nose done, because the risk is much higher of possibly getting some of that filler in a blood vessel. The rest of the face is very low risk and very satisfying to do. But I think when you're looking for a clinic, you should look for one where there's a doctor present, that's medical, that has good standards.
And speaking of standards, which treatment requires the highest safety standards? What do I need to know?
To be honest, I was ahead of myself, wasn't I? Because it's actually dermal fillers.
Oh,
I mean, if something's going to go wrong, it's dermal fillers. And also, the other thing that can go wrong is with the IPL. The intense pulsed light, we call it the hot flick. You can burn someone with that.
Right, okay, so go to someone
Well, you really want to know that. I think you should go to a medical clinic with proper training and standards, and, you know, then you'll feel better.
Now, talking of feeling better, right, if there's something to improve the face, the neck, chest, back of the hands, what sort of combination treatments are going to work?
I think
I'm asking for a friend.
Yeah, all right. Well, I think combination treatments are very important because I think you get better results, because 1 + 1 = 3.
Right.
This is a single treatment using a gentle laser that you can walk in and out from.
Her pigment is gone.
Some of her pigment's gone, but we did it for her rosacea. And she never had any downtime, she didn't have any pain, and she was really happy with the tightening and the collagen production.
amazing.
So that's a simple treatment that you can use on the darkest skin as well. Now this is a combination of the laser genesis that I just mentioned plus IPL, and that is only one treatment.
And look at the sunspots.
Yes,
Wow,
and the
really
redness is
reduced.
gone. You can see the texture's improved as well as the brown and the red. So when you combine treatments together, you get a much more profound result.
So for those of us that are a little more nervous about having these treatments, how can we support our skin from the inside?
Yes, well, I think you need to really start from the inside first anyway. Enough sleep, highly plant-based diet, be on a good multi, vitamin C, sort out your zinc, take fish oil, swallow hydrolyzed collagen. If you want just wrinkles, it's 8 grams. If you want more for your internal health, it's 12 grams a day. And then with your skincare, have something derived from vitamin A at night with your antioxidant cream. Have your vitamin C serum in the morning and antioxidants, and put a sunblock on. Keep putting your sunblock on all through the day.
It's hard to look good, isn't it? There's a lot of stuff
Takes
to
a lot
do.
of time, doesn't it?
Get a regime and then you're
There's
underway.
a lot to remember.
Is there anything else we should be doing, Frances, coming up to this,
I
summer
think,
period?
Don't let yourself get sunburnt.
Yeah.
If you've got darker skin, you need more sun. You can't have the same sun as anybody else, but just do not let yourself get burnt, but get enough sun.
Thank you, Frances, and sleep as well. Nice to see you. We'll catch you next time.
See you
and
soon.
to find out more, visit Dr. Frances's clinic at skinfresh.co.nz.